Welcome to Neutral Voices, Voice of the People. And we're going to have a conversation today, and we have a guest in the house. But before we get into our conversation is going to be about Alzheimer's and dementia. Approximately 14% of Black people over the age of 65 suffer from dementia or Alzheimer's. Now, as the age increased to 70 plus, that increases to 21.3% of the people that suffer from Alzheimer's and dementia. So this is a prevalent condition in our community. Not only our community, it's just overall, but we're looking at our community that it affects a lot. And we have a guest today, and I'm going to introduce her, and then she's going to give us a little bit about herself. Her name is Patricia Wilkins-Smith. Hello, how are you today,
Hi,
ma'am?
Patricia.
Patricia, Mama.
Hi. Thank you guys for inviting me.
You look really pretty.
Thank you.
Oh, Jill, come on, save it. First of all,
I never say that to
First of
anyone.
all, give us some background. Let us know how you know or what you've done with dealing with Alzheimer's and dementia.
Being a nurse, I was at one time involved with the Alzheimer's Association when it was here in Fort Wayne. And I did do a group where we did families. They would be able to come together and just talk. It was called the Alzheimer's Support Group. And it was mainly made up of caregivers that would come together and just relate with each other about what was going on with them and their family member that was suffering from the disease.
Okay, okay. Now, and we had done some research, and we want to understand, and we want our audience to understand. So we don't want anybody to be confused. Is there a difference between Alzheimer's and dementia? Can you tell us what's the difference, and what is Alzheimer's or what is dementia?
Alzheimer's actually falls under the umbrella of dementia. There are several diseases that falls there, and Alzheimer's is the number one. Dementia is a term used to describe memory loss. And so again, in Alzheimer's, it's a continual deterioration of your memory, your cognitive behavior, everything that you say and do, you get to the point where you can no longer care for yourself.
Okay, okay. Now that's a lot. Now, what are some of the symptoms of Alzheimer's or dementia? Say, like, I have a relative and I don't know, or I start seeing things funny. What are some of the symptoms, some of the signs? And what age, is there an age group in which Alzheimer's or dementia begins to develop?
It used to be they would say 60, but we're noticing it starting more and more at younger ages. It can be environmental, um, just so many things, because one of the things that it is about that, just memory loss is not dementia, it's not Alzheimer's. You know, you walk in a room and forget something and have to go back and retrace your steps and remember what it was that you went for. Doesn't mean you have Alzheimer's or dementia. But when it really sets in, it's subtle. If you are living in the house with that person, you don't notice it because it's so subtle. They'll put their keys here and walk away and can't find them. They will do things that they normally do on a daily basis, and all of a sudden, those things start to become hard for them to remember how to do. And so it can be very subtle, but as it progresses, you begin to notice more and more that they are forgetting how to do daily activities that they've done repeatedly.
So I just want to make sure I understand. So the Alzheimer comes first, or the signs, and then it turns into dementia, or
No, dementia, Alzheimer's fall under the umbrella. Dementia is the big picture
okay,
Okay.
because it could be vascular dementia, like a person that has a
Okay.
stroke.
Mhm.
That's vascular dementia, which
Okay.
means they can be to the point where they can have long term memory, but their short term memory is shot.
Okay.
Okay.
Like we're having a conversation now, something that was said 5 minutes ago, if you've had a stroke, you can't remember
All right.
what happened 5 minutes ago. Lewy body disease falls under the dementia umbrella. but Alzheimer's is the one that seems to affect more people
Mm.
and gets worse. Alzheimer's technically can't be diagnosed until you're dead because they cannot dissect your brain while you're alive to
That's
find
Wow.
out
interesting.
what's going on there. So
Wow.
technically, it can't be diagnosed until you're dead.
And with that being said, I know, correct me if this is just something that I've heard, but they, because of that, they will never tell somebody that this is their diagnosis. They just go off of the symptoms
That
and
is
then
correct.
treat the actual
Symptoms.
symptoms.
That is correct.
Okay.
Because again, you can take out part of your liver and diagnose, but you can't take out a part of your brain to diagnose Alzheimer's.
Yeah. Okay. Now, are there any particular causes? Are there any particular things that lead up to Alzheimer's or dementia? Is there, say, like, and we studied and we talked about, they say like alcohol, prolonged alcoholism or things such as that. Is there a particular cause for Alzheimer's or dementia?
There's not one that you can readily say, but those things contribute. Smoking contributes because smoking, the nicotine affects the brain. Alcohol, anybody that drinks a lot of alcohol over time, that will affect your brain. Eating too much of certain foods, like if you are diabetic, because that led to diabetes, so all of those things lead into it, but there is really no set thing that you can say this caused Alzheimer's.
Right.
But it sounds like you just said, and I'm sorry, I'm a sugar baby. So when you
You
say
better let up off that sugar.
that's what I want you to talk about. So
Because-
I like the sweets, and so you saying that could lead to
Yeah,
Alzheimer's?
because it can lead to diabetes.
Mm-hmm.
So the fact that you have diabetes, that stops the blood circulation,
Okay.
and the blood goes to the brain. So you're taking those bad things into your brains. Yes.
Mm-hmm. Mm-hmm.
Oh, yeah, and the alcohol and all that. Yeah.
Mm-hmm.
You said there's no real cause or anything. There's things but are there precursors? Are there certain things you mentioned? Diabetes, and we know your stroke would have to be blood pressure or things like that. Are there precursors that would show, like you at 35? Well, they say a family history of like breast cancer and colon cancer, you might have a precursor or be predisposed to that. Is there a precursor to Alzheimer's or dementia?
They do say that it is hereditary in a sense. Usually, if your mother have Alzheimer's, 9 times out of 10, if she's got 2 or more children, one of those 2 children will eventually end up with Alzheimer's. They don't know why, but it will happen. So in some essence, it is hereditary. But then it's environmental. When we stop to think about all the chemicals and stuff that's in the air that we're breathing in, all the different things that we use, even the food that we eat. At one point in time, and I can say in my time, people had gardens. They raised their food. Now everything is microwave. We use the term microwave because a chicken, when I was growing up, it went from this little bitty thing to weeks and months before you ate it. Now, 2 or 3 weeks after the egg hatched, the chicken is on the table. So all of those things contribute to what's going on. You don't really know what you're putting in your body.
So almost like the hormones that they give in the chicken, because you're right, the chicken is supersized now and super quick. And so those hormones, I would imagine, could cause those problems too.
It could cause those problems because you don't know exactly what you're getting.
Wow.
Well, and you led into another question, and the chickens and all of that, not only the diet, but let's think about if you're on blood pressure medicine, if you're on diabetic medicine or things like that. Can some of those things lead to, because you hear medicine and then they give you 115 side effects, but you go to the doctor under the assumption they're going to care for whatever your symptoms are. Could that be a factor into?
You really never know, but yes, anything that affects your brain can be a lead into those things happening.
Yeah. Now, how did you get into or get involved, or what piqued your interest in working with Alzheimer's or dementia patients?
Because I worked in a long-term care facility for, I'm pretty sure, 20 years of my career, maybe more, was in long-term care facilities. And a lot of people in the long-term care facility don't have family members that come and check on them. And so just watching the different stages that they go through made me want to learn more about it. And digging into it and learning more about it, talking to family members is what got me involved in it.
And so with that and mentioning family members, what have you seen as far as the stress level of the caregiver, the family members? What are the complaints, and how do you try to help them cope with dealing with people with Alzheimer or dementia?
Because when they have them in the home, and I'm not an advocate
Mm-hmm.
of putting your family member away, that's the term people use, but sometimes it's best for the Alzheimer's person to go into, if not just a long-term care facility, but somewhere that they can be around people that, I don't want to say communicate, because it's not a form of communication as we see it. But when they're around other people, they may just be sitting there jibber jabbering, but they get that socialization out of it. Whereas at home, the caregiver is so busy focusing on the house. There are other family members there. 9 times out of 10, the caregiver have children or grandchildren, a husband, a wife, or a job outside of the home. So they don't have time to really dedicate to the person that's suffering from dementia. So the caregiver gets run down trying to do everything, because with Alzheimer's, a person eventually becomes to where they are. My grandmother used to use this term, once an adult, twice a child, because that person with Alzheimer's, they go back to wearing depends, and they go back to not being able to control their bowel movements. They go back to the point where they no longer realizes how to take the spoon, put the food on it, and put it in their mouth. So that caregiver is doing all that. They're hand feeding them. They're taking them to the bathroom. They're giving them baths. They're cleaning them up. They're making sure that they are safe, not getting to the stove, turning the stove on. All those things that we don't think that's out of the ordinary, but a person with Alzheimer's don't know how to not do those things.
Right. We talked about that last night a little bit, as far as I'm glad you went there, because you said you were in the field for quite a long time, and so this was something that you had seen, you had been around, you were a little familiar with dementia. How do you think, because I know some people personally who take care of their spouse, let's say, with Alzheimer's. So this is somebody who had no medical training, who literally went from being a wife to a caretaker overnight. Can you kind of tell us what that would feel like emotionally on somebody who takes on that role as a spouse or family member?
I think it's devastating to take on that role. To think that you've been married to this person 30, 40, maybe even 50 years. You communicated sitting there at the dinner table. You went out together to different places. All of a sudden, you're leading them around like you did your 2-year-old.
Right.
And I really think it would be devastating to be, and then again, to be a child.
Yes.
Taking care of your, I'm going to say a female child taking care of your dad. That's not just something you do. You don't see your dad without clothes on.
Right, right.
But you're at this point now where you are giving your dad a bath. You're changing your dad because he no longer knows how to take himself to the bathroom. Or a male child taking care of their mother. that's just not something they envision doing.
No.
Or maybe comfortable.
Yeah, even
Yes.
comfortable
Right.
with doing,
Yeah.
Mhm.
but it has to be done.
Yeah. Now, I don't know anybody else's, but I remember my first understanding or foray into seeing Alzheimer's or dementia. I had a great aunt and a great uncle, and they had been married for eons. Man, eons. And I think my great aunt got it first. Um, and she was the one aunt that I used to go spend all my summers with in Birmingham, Alabama. And it just was, hard to see, she was this vibrant person, like between the ages of 8 and 9. But when I turned 10, she became this totally different person. And my great uncle was shortly after that. So what I'm asking is there a slow progression? Is there a fast progression? What is the progression of Alzheimer's or dementia?
That is not something that can truly be answered because it works different in different people.
Mhm.
Some people can go 10 to 12 years before it's full blown. And some people, it seems like it's overnight that it happens. You can, 1 minute, to you, it seems like 1 minute they're up, they're vibrant, as you just said. And that was my aunt that he's referring to. And I grew up in her household, and it was so different because I had moved away when it actually set in. But she was a person that got up and went to work every day. She didn't drive, she caught the bus and went to work every day. And the neighbors started to notice, and she was an immaculate dresser.
Mm-hmm.
I mean, she didn't go outside without her hair combed and her lipstick on. But then the neighbors started to notice some of the days that she would stand out there on the bus line. She had on mixed matched clothes.
Mm-hmm.
Her hair wasn't combed. And they would think, oh, she had to be in a rush this morning and run out of the house looking like that. But as it progressed,
Right.
then they knew then something was different about her. And it wasn't understood as much then as it is now, but it took them a while to realize. So we don't know when it started. We just know when people realized there
Started
was
to
a
see.
change.
Right.
Mhm.
And
Well,
before we
before you-
hold on,
Oh, okay.
I just want to give a station break. We want to thank everybody for joining us
Patricia.
as we're here at Voice of the People, and we're talking about Alzheimer's and dementia. It's something that affects our community heavily. And as she alluded to, our guest is Patricia Wilkins-Smith, and y'all just heard her. My great aunt was her aunt, so that means that is my mother. Everybody, I
That's
just want
right.
to let everybody
Wonder
know
when
that
you
is
was
my
gonna say
mother.
something.
I was trying to hold it, but
Don't
she,
worry, I was
she-
gonna announce
yeah,
it.
you was gonna announce it. But go ahead,
Yes.
Doc V.
Well, no, I just wanted to. I'm going back to with you saying all of that and just painting that picture. I'm thinking about. I think a lot of people forget that they need to be patient on a whole different level with somebody that's dealing with that, because when it comes to like putting on their shoes and helping them with different things, we as people, we can get in a hurry.
Yeah.
And we're rushing people, but we have to be patient, it sounds like, with somebody that's dealing with Alzheimer or dementia.
Definitely, because I know in the early stages, I do know from being working a long-term care facility, in the early stages, they are frustrated. They know that the shoe goes somewhere, but where does it go and how do you get it there?
Wow.
They know that the shirt goes, you got to get it on, but what hole goes over your head? Where does the arm go to make it go correctly? And so you do have to be patient, not only patient with the person that has the disease, but be patient with the caregiver. When someone have their parent in the home, be patient with that person. Their fuse to you may be a short fuse, but to them, that fuse is a lot longer than what we see.
Absolutely.
Yeah.
Right, because there's something happening with the muscles, as far as I researched, because I didn't understand it, and I was sharing a story about when my students would go to the nursing home and we would try to do manicures. Well, the students had a hard time because some of the people, seem to snatch back, but it's because the students were trying to straighten their fingers out
Right.
and they couldn't.
No,
And so
that
they
is
had
correct.
a real strong grip. And yeah, so talk about that a little bit.
That's because they don't use it. Atrophy sets in because they no longer have the ability to know how to do those things. So anything you don't lose, you use, you lose. So you lose that muscle mass because, and it's called atrophy because they don't use it. They don't know how to button a shirt anymore, so they don't try anymore. They don't know how to pick up the spoon. So those things happen. Atrophy sets in.
And so what's causing, like some of them that even may start drooling and different things like that?
They don't know to swallow.
Wow.
You don't
Wow.
think about all of that.
don't
You
even-
don't
Yeah.
think about it. It's the same thing. They get to a point that they no longer know how to chew and swallow. So in long-term care facilities is when you notice that they have all their food is soft
Yeah, to feed.
or liquefied
Yes.
so that it'll go down and they get the nourishment. But they don't, it just goes away, the chewing and swallowing.
And so because we learned that there's so many different stages, would you say you have seen all of the stages from the beginning to the
Yes,
most
I would say they say
dramatic?
there are 7 different
Yeah.
stages. So yes, in my professional life, I have seen all 7 stages because the final stage is when they no longer walk, they no longer talk, they no longer feed themselves. They are like an infant, but they're not infants. They are adults.
Right.
So as this, you just said something. So as this progresses, as the Alzheimer's gets worse, and like you said, when a person forgets to use their hand, they no longer use it. When you forget to, so as it progresses, and as the person forgets more and more and more, you're saying, is that what really takes a person over? Is that their everything just kind of, by not using it, it shuts down?
It shuts down. And that's the term. If you don't use it, you lose it. And we on the outside tend to compare them as children. They're not children.
Yeah, right, right.
But we do. We do on the outside looking in go, oh, they're back to acting like a toddler. No, they're not.
Right.
It's the disease.
Right.
They don't go back to being children. They may soil themselves, but it's not a child.
Right.
A 2-year-old doesn't get embarrassed when they soil themselves.
Right, right. That's an adult.
That's yeah. But these,
Always an
they
adult.
are embarrassed by that, but they don't know how to voice that they are embarrassed.
Right.
Right. Well, and I have, you said you can't, there's no real precursors, there's no real cause of it. Is there any way that it can be prevented?
At this point, no, there is no way that they can be prevented. There are some medications that they say slows the progress of it, but it's all like you just don't know. It's you really just don't know
Right.
how much of help it is. There, if you watch TV, all the medicine they say, it brings your memory back, but how much of it is it really bringing it back, and what is it really doing? Because you're not in that brain, so you really don't know what is happening. But if you are prescribed a medication or you have a loved one, my advice would be to continue with that medication, because if they're giving it, it's helping, it's not hurting.
Right.
Right.
Right. Now, you touched on this earlier, and we had a conversation, and we had 2 sides of the coin yesterday, and you touched on the caregivers. Now, is it wrong for a person to place their loved one in a, because our culture, we are supposed to take care of, or we don't want to, put our people away, is the term you use. Is it wrong for us to put them in a professional environment for them to get the help and treatment? Because we don't want to most of the time.
I would say no, it's not wrong, but it still goes back to an individual choice. you know how much you are capable of doing. Are you helping your loved one, or are you hurting your loved one
Mm.
by holding on to them? And I've said this to my children: I don't want them to take care of me. I don't want them to not come and visit me, but I don't want them to take care of me, because that ends the caregiver's life as they know it as
Mhm.
well.
Yeah.
They are no longer free to jump up and run to the store. They are no longer free to go out and enjoy an evening, because they're worried about, if they left that person at home, are they going to be there when they get back?
Right.
They are worried. They don't. They have sleepless nights
Yeah.
because that person at a certain age, they become wanderers.
Yeah.
Mm-hmm.
They get outside.
Yes.
Yeah, you hear that.
And
That's
when
what
they
I
get
wanted to know about.
outside,
Yes.
they don't. They're out there, but they may walk. They may be used to walking from this end of the street to this end of the street every day.
Mhm.
But this particular day, instead of going that way, they go that way, and they're lost.
That's
Mm.
it. Yeah.
Yeah.
And if you're in bed asleep and they get out, how long have they been out? Where did
Where
they
did they go?
end up?
Mhm.
Where did they go? Did they walk out in front of a car?
Mm.
Did they lay down in somebody's backyard? So
Mm.
all those things are things that happen. So again, I go back to, it's an individual's choice.
That's a
Wow,
lot.
there's
You
so
know,
much to think about.
right.
The man that we, first of all, that we take for granted.
Right. Right.
But then I'm just thinking about being the person that's caring for them, because what you're saying, yeah, going out and having it, a night out, or going to dinner, etc. That's one thing, but just going to sleep,
Mhm.
because
Yeah.
this also affects their sleep,
Right,
right?
correct.
And
The
so,
caregiver, we often hear the term in our profession that the caregiver goes before the person they're
Yeah.
caring for.
mm,
And that is because they don't take time for themselves any longer.
mhm.
They are totally focused on giving care to that individual. When you have small children, you hire a babysitter, you
Yeah.
go wherever you want to go and enjoy yourself, come home, the babysitters put them to bed, and you're fine.
Mhm.
You don't give it a second thought.
Right.
You can't hire a babysitter for your 90-year-old dad or your
Yes.
70-year-old mom.
Right.
You just can't, because unless you have someone that is also a professional caregiver, your loved one is not safe with that person
Right.
that you have watching them.
Right.
Right. Right. That's a lot to digest. And we thank you for this
It's so
information,
sad.
because I think we didn't know a whole lot, and you have enlightened us as a panel, and I'm sure many of our viewers. But can you give some resources, help for caregivers, or even people that don't know or they're beginning to see signs of dementia for their loved ones?
Okay, there is a local number in Fort Wayne that you can call. I am not 100% sure that there's still an office in Fort Wayne, but if you call 260-420-5547, they can connect you with either a virtual support group, or tell you if there's someone meeting locally, or how you can go and just talk to somebody that is a caregiver. There's also a 1-800 number here that I do have for the Alzheimer's Association, and it's a 24-hour, 7-day-a-week number helpline that you can call, and it is 800-272-3900. And if you call that number, and they will ask what state and what city you're in, and they will be able to connect you with somebody in your state, if not directly in your city, that you will be able, and they can give you all the information that you need. They can tell you where to go to find information, and give you, they even have a newsletter that comes out. If you dial that number and sign up on their website, they will tell you where, and give you newsletters and give you information of what's going on. I do know that Fort Wayne have an Alzheimer's walk each summer, and get out Get involved. Find
Yes.
out what you can do to help yourself and help your community. Because as you said when the show began, there are a lot of people in our community that are suffering and they don't know. A lot of families don't know that there is help out there for them.
Right, right.
Yeah, thank you for
That's
that
good.
info.
Thank you very much for
Yes.
that info. We want to thank you again, Miss Patricia, for giving us and joining us. We greatly appreciate the information. But before we leave out, is there any other questions that we have?
Can I just ask her a question about the electrical outlet?
No, you can't
we're
ask
done
that
with
question.
it.
No. You're
Then
not
no,
gonna-
sir, I have no questions.
Okay. All right, Jill. But no, here's the thing. There's so many people in our community that are suffering from Alzheimer's and dementia. I remember at a time we just called it being senile or having senility, or we just thought that's the way the people were. That's not true.
True story, yeah.
Go out, get an understanding, get some help for your family member, and also know yourself. Pay attention to yourself and your body because you never know what's going on. Get the proper health treatment, get all the things that you need. But we want to thank you for joining us, and we hope that something was said that enlightened and helped somebody. And Jill, I'm gonna give you the pleasure since you want to talk. Before we leave our
Since I
people,
want to talk.
before we leave our people every night, what do we always say?
Remember to always protect your mind. And thank you, Patricia, for being with us.
Thank you all, and have a good night.